Okay, let me start by introducing myself. My name is Dionisia Ward. I attend LSUS, and I recently had a kidney failure experience. Not me personally, but someone that I'm very close with. I guess I can tell you a little bit about his story. His name is Mark. He, originally he just had flu-like symptoms. We even heard that he had strep throat. And it wasn't until we went into the hospital that we found out that he had kidney failure. It was, I guess, a complete shock. Because, at that time, we didn't really know, what the kidneys were for. We knew that you could live with one kidney, but we didn't know exactly, what they did. So, I guess now I can explain to y'all, what the kidneys are. So, kidneys are basically two bean-shaped organs about the size of a fist on your lower back. The National Kidney Foundation tells us that the kidneys have these things called nephrons that filter your blood, and some things called tubules they filter the blood and get rid of the excess water, or they can actually put water back into you depending on your body's needs. Your kidneys filter about 200 quarts of fluid a day, and of the 200 quarts, only about 2 quarts of it is urine. Many things can cause chronic kidney disease, which is also kidney failure. Chronic kidney disease is any type of kidney abnormality. Common causes for it is high blood pressure, diabetes, and then, basically excessive amount of pain pills such as Tylenol, Advil, Aleve, it can build up inside you and, cause kidney failure. Basically what your kidneys do for you is filter the waste, the excess drugs, and, gets rid of the excess fluids in you. It also regulates your blood pressure through different hormones. So what I'm here today to do is to explain exactly what happens to the body when your kidneys fail, the psychological aspects of everything, and then the process that happens once diagnosed with kidney failure. So, you're diagnosed with kidney failure when you have a high level of toxins in your bloodstream, and basically from there, you have these different symptoms. Basically uremic. Uremic is an excessive level of toxins in your blood. Symptoms of uremia can range from anything being like a lack of sleep, a loss of appetite. You can have a metallic, like a bad taste in your mouth. You don't want to do anything. PD nurse Shauna actually says that when you have a high level of phosphorus in your bloodstream, well, okay, a PD nurse is a peritoneal dialysis nurse, which is basically a kidney nurse. So she says when you have a high level of phosphorus in your bloodstream, it can cause you to be moderately to severely itchy. So that's another symptom of, kidney failure. And actually before Mark went into the hospital, he had a weight gain. And, after finding out about the kidney failure, they actually said that the weight gain is due to excess fluid, which caused his body to swell up. So he gained about 30 pounds. And also, along with the itching and the weight gain, Shauna explained to us that you should stay away from hot, long showers because you don't want to take all the oils off your body because of the phosphorus buildup, it can dry your skin. And, that moderate itching can become real severe, almost like a stinging pain. And only way to get this pain to subside is to get the right treatment. As far as treatment goes, which brings me into my next thing, it would be you can have dialysis, you can get a transplant, or some people actually do nothing. Dialysis basically acts as your kidneys. It filters your blood and remove the toxins and things like that. There's 3 types of dialysis. There's CAPD, APD, and hemodialysis. CAPD is continuous ambulatory peritoneal dialysis, which basically like you take it 4 times a day at home, and it basically allows you to have like a normal life. APD is ambulatory peritoneal dialysis, and you do this at home while you're asleep. Both of these dialysis, you have to be very sterile at home. You're not around nurses and things like that, so you have to be very clean and things like that. Peritoneal dialysis and hemodialysis differ. As for peritoneal dialysis, you're dealing with your peritoneal cavity and the fluid is placed in you to where it dwells. Hemodialysis deals with your blood, and it filters your blood directly. And this is just done 3 times a week. You don't have to do it every night, but you do have to go to a clinic in order to have it done. The next step would be, a transplant if you were able to get one. Depending on your condition, if it's only kidney failure or if you have other organs fail, then you may qualify for a transplant. This is a long process. As explained by PD nurse Shauna, she says that you actually have to be stable first through medicine and other treatments before they can test you for a transplant. And then, once you're stable and you're tested, then, they can see if you have a match. A match isn't, a 100% perfect match. You can just be compatible. But 2 things have to match exactly, and that's going to be your HLA type and your blood type. Once you find out that, you can go get placed on the kidney transplant list, and then you can see if any of your family members, friends, and people of that nature are a match for you. With any diagnosis, it's going to have some psychological aspect to it, and whether it's good, as in acceptance, or bad, as in depression or denial, you're going to have some mental emotion, I guess, toward it. Shauna says that most of her patients have some sort of denial or depression phase to where they don't accept the fact that they have kidney failure, and they, don't take it as serious. I mean, every patient's different. They have, different experiences, and some actually never accept it at all, and they continue to want to live life as they did before, causing, more and more medical problems that could eventually lead to death. All in all, basically, with kidney failure, your body reacts to it through swelling, itching, loss of appetite, and a lack of sleep. Mentally, you can become depressed, go through stages of denial, and until you reach the acceptance stage, you won't continue to better your health. And the process of actually getting back to where you want to be with this chronic kidney disease and life, getting back to a normal life, it can be a long process, but I think it's one that you must endure in order to get back to where you want to be. And that's all.